Hi everyone, my name is Dr. Amy Abelar and welcome to another episode of the intersection of motherhood and entrepreneurship. In this video, we're going to talk about how to prepare your patients for your maternity leave. There's a few things that I want to touch on in this video. First is if you are going to be either handing patients off to another provider in your office or handing patients off to another provider that's going to be outside of your office, you do want to make sure that you have a place to refer them. So either I've hired so-and-so, they're going to be in my office treating patients on these days of the week while I'm on maternity leave, you can see them, blah, blah, blah. Or I don't have anybody who's going to be in my office will be closed. Here's a list of providers that I recommend in the area, that I've let them know that I'm going to be on maternity leave and you can go and see them. You know, this person has this specialty, this person has that specialty, etc. So there's another video that talks about like delegating and whether you're going to hire a provider or whether you're going to refer out. So you can watch that one. But preparing from the perspective of preparing your patients for your maternity leave, you want to make sure you have somewhere to recommend for them and somewhere to refer them while you're going to be gone. And ideally, it's something that you've already set up as like an autopilot thing and not something where, you know, you're at home with a baby and you're tired and people are calling you saying, who was that you were referring to me? You know, I think I mentioned this in the other video, but, you know, change your voicemail recording if you're going to be completely out of the office. Change your voicemail so that your voicemail recording says, I'm out of the office for, you know, this amount of time or until this date. And here are the list of providers that I recommend people look for treatments with while I'm gone. And that way it's on your voicemail and that's it. You don't have to be, personally sending this information to people. Okay. So that's one of the things that I think is going to be important. The other thing that I just really want to touch on is take your maternity leave and enjoy this time. You will have a wide variety of patient responses when you talk about maternity leave. I had patients who were like, you're not going to have any more kids, right? Because I don't think I can go another, I don't think I can, last another maternity leave for you. Which from the one perspective, you're like, wow, that's really sweet and kind that you are, so loving of my services. And on the other side, it's like, wow, that's a lot of pressure to put on a person, my deciding factor of whether I have another child or not is not determined based off of this patient saying that they don't want, they don't want me to take another maternity leave, right? So, really just be prepared that patients are going to have a really wide variety, of what they're asking for and what their responses are for when you tell them about maternity leave. Some patients will be very supportive, enjoy this time, snuggle, soak in all those baby snuggles, take as long as you need, who do you think I should see while you're gone? Let me know when you're back. Some people will be very supportive and others will not be so supportive. So just be prepared for that. But I also want you to keep in mind that this is your maternity leave and you should enjoy it and make sure that you make it as much of what you want as you possibly can. And I know that we're people pleasers, a lot of us, and we want our patients to be happy and we want to be taking care of our patients. But I have to say it. If you feel like your patient is holding you hostage because they're saying, well, I need my regular acupuncture and I'm not going to see anybody else. I'm not comfortable with anybody else. It has to be you. That's a them problem. That is not a you problem. You have to take care of yourself. You need to set proper, healthy boundaries. And what if you want to take a vacation? What if you get ill and you're out of the office for a while? Maternity leave is no different, where this is a time in your life that you are going to want to take or you're going to need to take. Your body needs rest. You need bonding with your baby and that baby needs bonding with you. This is not the time to be feeling guilty for what other patients are saying that they need. And it is not your job to be available for them whenever they need to. Legally, you need to provide options for where they can see somebody else if you are not going to be available. So having a referral list or having another provider in your office are two of those options. But you coming back from maternity leave too early is not a requirement because a patient is saying that they don't want to see anybody else. So I just need to validate that for you. I personally experienced that. It was very hard. I actually ended up at one point trying to figure out like, oh, well, maybe at like 3 weeks postpartum, if I'm feeling good enough, my mom will be here. She'll be helping me with the baby. Maybe I can come in for a patient or two. But I also was collecting disability because I was on maternity leave, and you cannot be collecting disability and be going in and treating patients at the same time. So I decided, you know what? They're going to have to wait. There's another acupuncturist literally in my office that I employ who is available that they could absolutely see. And they did, this person who was very like, I'm not going to see anybody else. They needed a treatment and they went and saw her and they felt fine. They got a great treatment. They felt better afterwards. And then they waited, until I came back after that because they were, they're very loyal. They didn't want to see anybody else, but there was another person who was there available to treat them when they needed it. And even though they said they refused, they weren't going to, they did. And they were very happy and they were fine. So take the maternity leave that you want to take. If you can take a longer maternity leave and you want to take a longer maternity leave, then you should, right? If you can financially afford to, you should take that time. So preparing your patients, one of the other things that I liked to do was prior to me going on maternity leave, I didn't really take on new patients because I felt like it was either not appropriate for me to take on new patients when I wasn't going to be able to be continuing to treat them, or, and also, to be totally honest, I also wanted to make sure that the other acupuncturist schedule was full too, right? I knew that there would only be so many of my patients who would want to be seeing her while I was gone, and some people would wait. And so I wanted to make sure that her schedule was full. Anytime you hire another provider, you want to try to make sure that their schedule is full. So as a general rule, most of the time, when you hire a new person, you are usually telling your front desk to try to book with that person first, book them those new patients to start filling their schedule. So we were kind of doing that anyways because I hired her about 6 months before I went on, or about 6 months before my daughter's due date. And so we were already trying to send more new patients to her anyways. And then also, if I was having a really bad day during that pregnancy, which happened to me, unfortunately, way more often during my second, if I was having a bad day, if I was feeling really, if I was feeling a lot of pain, if I was having trouble walking, if I was feeling a major morning sickness, and I thought I was going to have to take maternity leave early, I had to really condense my schedule to like 3 half days a week was pretty much all I could handle towards the end. And so during those timeframes, I wanted to refer people out anyway, to refer people to the other provider that I hired. So, preparing your patients by having somebody available for them, whether it's in your office or outside of your office, and then really just respecting your time frame, and taking the kind of maternity leave that you want to take, I think is hugely important, because you will end up likely resenting those patients if you come back too soon, because especially if this is your very first maternity leave, you will never get another time like it. And if you don't take that time and really just fully spend that time at home, you'll end up resenting some of it later. And so I just really want to encourage you, take the time that you want to take. If you can afford to take more time and you want to take more time, you should. Maternity leave is not a vacation, right? Maternity leave is, you just gave birth to a baby. You're having to recover physically, mentally, emotionally from that. If you're trying to breastfeed, you're going through all of that. If you're trying to formula feed, you're trying to deal with all of that. If you are, there's bottle washing, there's diaper changing, there's figuring out a sleep schedule, there's trying to get your own sleep and your own shower, and figuring out this new dynamic in your family between you and your partner and the baby and all of the things, right? Like, it's a lot. It's not a vacation. It is a time that you're trying to navigate all of these major changes into your new life, and you're trying to bond with your baby and still try to figure out how to be, how to figure out how to feel connected to your spouse when you're both just like absolutely exhausted. So take that time, do what you need to do. And if that means that it's a little bit longer and you don't come back just yet, or that means that you're extending time, then that's what you do, right? So, I never set a specific return date. I said I'm planning to take around 8 weeks, or with my first, I took 8. With my second, I think it was closer to 10. And so I took, I took more of that time. And I think that you should just take the time that you want. And again, I've said that several times now, but I really just want to hone that in, because especially if you're self-employed, it can feel scarier to take more time off. It can feel scarier to have clients that might leave because they're not happy that you took as much time off. It can feel, you can feel obligated to come back sooner. You can feel all the things, right? And let's say your disability runs out at 6 or 8 weeks and you want to come back for like a day and work on several people. You can do that, if you're not collecting disability anymore. And then, maybe you take off another week or two. Maybe you come back very, very slowly with 1 day a week or 2 days a week before you transition to fully getting back in. I have a whole nother video that talks about that postpartum period and kind of how to navigate returning to work. So we'll get more into that then. But again, just to be a broken record, take the maternity leave that you want to take. You won't get very many of these opportunities, and you'll have years and years and years of practice to treat patients. Okay.